Hello everyone, my name is Dr. Paul Richardson and I'm the Clinical Program Leader and Director of Clinical Research at the Jerome Lipper Multiple Myeloma Center at Dana-Farber Cancer Institute in Boston, Massachusetts. And it's my pleasure to be here at IMS and to be talking to HealthTree about the various advances that we're discussing at the meeting, that it's been my privilege to be part of actually the presentations and discuss them with colleagues at this fantastic meeting in Toronto, Canada. The data here at the meeting around Mezigdomide are particularly promising. This is obviously a very exciting oral agent that it's been a privilege to be part of the development of over the last 5 or 6 years. And what we've seen here with Mezigdomide is dramatic results that are highly effective in combination in the relapsed refractory setting. So at this meeting we were discussing in various settings the role of Mezigdomide in relapsed refractory myeloma, and in particular in combination with both bortezomib or carfilzomib, and indeed in combination with other agents such as other novel drugs. And what's very exciting about Mezigdomide is to have a really potent but generally well-tolerated oral agent that provides with us the real promise of being able to overcome resistance to most other classes of drugs and confer significant clinical benefit. Just to give everyone a sort of flavor of what this looks like, the combination of Mezigdomide combined with bortezomib, even in bortezomib-exposed and/or refractory patients, gains response rates of approaching 80 to 90%. Similarly, in the context of patients receiving carfilzomib, similar response rates are achieved. These bode very well for the success of so-called Successor 1 and Successor 2, which are large randomized trials that we believe will be hopefully a platform for approval next year for Mezigdomide for our patients in the relapsed refractory setting. And then finally, in the setting of BCMA and CAR-T directed treatment failures, unfortunately, or in patients in whom CAR-T and T-cell redirection has unfortunately failed them, I should say, in that setting, the use of Mezigdomide combined with other novel agents shows great promise. In the so-called novel study, which we have data here presented at IMS, we've seen response rates in excess of 70% for this all-oral approach, even after not only have these patients become triple-class refractory, but most importantly, unfortunately, these patients have seen BCMA-directed approaches run out of benefit for them. And for them to then be able to benefit from an all-oral approach in combination and see response rates in excess of 70%, obviously is very promising. So lots of excitement, lots of good things, and above all, I think with Mezigdomide, the ability to have an agent that it can be readily administered and easily dispensed in the clinic is such a benefit and such a potential step forward for our patients.